Welcome, everyone. I'm Dr. Jody Jacobson Fry, co-chair of the Workplace Suicide Prevention Committee. Welcome to our webinar on mental health crisis services in Black communities. I'm honored to introduce our speaker today, Victor Armstrong, Director of North Carolina Division of Mental Health, Developmental Disabilities, and Substance Abuse Services, and board member of United Suicide Survivors International, as well as board member of the American Association of Suicidology. This webinar is part of the National Guidelines for Workplace Suicide Prevention, which were forged by a partnership amongst three organizations: the American Association of Suicidology, the American Foundation of Suicide Prevention, and the United Survivors of Suicide International. The national guidelines are forged upon 8 guiding principles. Today, we will focus on the guiding principle of empowered connection. The national guidelines are also comprised of 9 practices. These include upstream, midstream, and downstream approaches. Today, we'll be focusing on crisis intervention response, including accommodation, reintegration, and postvention. I'd like to turn it over to our speaker, Victor Armstrong, to discuss the goals and today's webinar. Thank you, Vic.
Thank you, Jody. So today we're going to hopefully accomplish 3 major things. One is to understand the unique mental health stressors Black communities face. Number 2 is to appreciate the barriers to accessing mental health services. And number 3 is to develop a workplace mental health and suicide prevention plan that meets the needs of Black people. Black people have historically been negatively affected by prejudice and discrimination in the healthcare system in the U.S. And when we talk about discrimination in the healthcare system, the behavioral healthcare system is no exception to that. Much of what is woven into the fabric of the way that we historically approach behavioral healthcare does impact communities of color differently. And we'll talk a little bit more about that as we go along. We also have to acknowledge the historical and present day trauma experienced by Black people. That includes dating back to slavery, sharecropping, racial discrimination, and the civil rights acts of the 60s, but also the present day trauma that we've seen recently unfolding in our country with a lot of the civil unrest. And then Black adults in the United States are more likely than white adults to report persistent symptoms of emotional distress, such as sadness, hopelessness, and feeling like everything is an effort. In fact, Black people are statistically 20% more likely to report psychological stressors, yet are much less likely to initiate treatment and much more likely to terminate treatment prematurely than our white counterparts. There are many barriers to mental health in Black communities. First of all, there's a fear of labeling. It can be especially challenging for Black people to divulge mental health challenges due to concerns about how they may be perceived by others with competition and fear of labeling in the workplace. Oftentimes, for Blacks in the workplace, there's already a feeling that they have to work harder to achieve the same levels of success as their white counterparts. And for many Black females, there's a fear of being labeled as the angry or emotional Black female when they express feelings or when they challenge things that may be considered the norm. For African American or Black men, there's also always a fear of being labeled as lazy or incompetent, oftentimes due to mental health challenges, or these feelings and these fears can impact their mental wellness. There's a lack of access to culturally competent care. There's often provider bias and service or insurance disparities. For many Black people, access to care is not available in the communities where they live, so they're less likely to engage in services in their communities. This often means that for people of color, their introduction into mental health resources is often in the back of a police car or in an acute care emergency department, neither of which are conducive to good outcomes or that build a good relationship with the mental health system. And then there's mistrust, historical dehumanization, institutional racism, oppression, and violence against Black people cultivates mistrust that first responders and healthcare systems will help rather than harm. And there's always shame, the shame that often accompanies being labeled as a person with mental health challenges. But there are many additional challenges for Blacks in the workplace. Many Black and historically marginalized employees feel they can't be their real selves at work and may need more support for their mental health. There's often a feeling that they have to show up in ways that don't feel natural to them in order to fit in. And experiencing daily microaggressions and feeling like you have to code switch at work can be mentally draining for historically marginalized employees. About 4.5 years ago, there was a lot of civil unrest in Charlotte, North Carolina, much like we've seen transpire in the streets of many of our communities over the past several months. It was a result of the shooting of an African-American man named Keith Lamont Scott by a Charlotte Mecklenburg police officer. The result was a lot of racial tension, particularly between Blacks and the police officers, coupled with the fact that we were in the middle of a heated presidential campaign between Donald Trump and Hillary Clinton that also polarized and divided people. We found that it was spilling over into the workplace where many of our teammates were walking on eggshells around each other and not knowing how to talk about much of the tension that they were facing. But we knew that it was impacting their ability to work together. The way that we remedied that was we created what we called Let's Talk. We initially invited all of our teammates into our conference room, put the chairs in a circle, and decided that we were going to just have some candid conversation about how people were feeling and what was going on in the workplace. What we learned was that individuals in the workplace felt that not only were they uncomfortable around their teammates, but they also felt like it was impacting the way that we were dealing with patients coming into the facility. Many people felt that, for example, Black males coming into the facility as patients were treated differently than white males or anyone else coming into the facility as patients. They felt that those Black males were viewed as being more dangerous and much more in need of antipsychotic medication. But talking about this allowed us an opportunity to clear the air and for people to feel like they were being heard. The result was that Let's Talk became a part of not only our culture in the workplace, but it became a process. It was something that we did on a monthly basis where we invited employees to come in and talk about whatever was topical that was impacting our ability to work together. So there are several action steps that we can take and resources that we make available to Black people in the workplace and to all employees that can help people to feel more mentally healthy and balanced in the workplace. First of all, listen to Black employees, and there are many ways that we can do this. I mentioned our Let's Talk series, but there are also employee resource groups or system resource groups, whatever terminology you use in your workplace, that can allow, whether it's Blacks, Latinx individuals, LGBTQ, to have a place where they can talk and share like concerns. Take action. Not only provide a workplace that doesn't espouse racial practices and policies, but that does espouse an anti-racism policy and that provides psychological safety for everyone in the workplace. Develop guidance for a more inclusive and supportive workplace. When there are policies and practices in place, it becomes a part of the daily routine and the daily culture that can help individuals feel like they have a more inclusive and a more supportive workplace. Address racial trauma. Racial trauma is very real, and it is an experience in the lives of Black people in America. The more that we're able to address those things in the workplace and be supportive of the complex trauma that's been experienced by not only Black people, but all people of color, the more inclusive an environment you will create in your workspace. And take a whole person approach. Remember, people bring their whole selves to work. It's not just the individual that shows up from 9 to 5, but the things that people experience outside the workplace become a part of who they are when they come to work. So we need workplace policies that impact and affect not only the way people show up physically, but also addresses much of the emotional strain that people feel in their day-to-day lives. Evaluate and build relationships with culturally informed mental health and crisis resources. That means providing resources that take into account the nuances of race, culture, and ethnicity. So we've made available to you several resources that can help you to increase your knowledge and understanding of how to support Black employees in the workplace. We encourage you to take advantage of this list, which is by no means an all-inclusive list, but may help to start you on your way to having a better understanding of how to provide the support and inclusivity in the workplace.
Thank you, Vic. That was a wonderful, comprehensive overview of how we can better support the mental health crisis services in Black communities in our workplace. We've got some great resources that you saw, and now we'd like to call you to action. Please take a minute to go to www.workplacesuicideprevention.com and take the pledge to make suicide prevention a health and safety priority in your workplace or professional organization. Thank you again for joining us.